Mazira Medical Camp is one of the programs of the Mazira Foundation, and we started running the medical camps 5 years ago, and that's because we realized there's a need in the community.
We have grown as an organization, and we have begun to consider more sustainable ways of advancing our programs, particularly based on a philosophy of preventive medicine.
The first day was a bit busy. We had so many patients coming in with high expectation, but we were ready for them because we've learned over the years what to expect on the first day, and the Passionate Hearts medical team was prepared to deal with the crowds. The Passionate Hearts medical team, it's a group that we just decided that since we always work together and it's easier to work with people who know and understand the vision of the foundation, we just changed the medical team to become now the Passionate Hearts medical team. The good thing is most of you have been here before, so you'll also help to give orientation to those who are here for the first time. Start with registration. It's a team of medical professions who have a heart to serve and a heart to give back to their community.
Mwili wako kama binadamu umetengenezwa na maji. Hasa vile unatembea tembea.
For me, it is a chance to reach the elderly and help them to know what kind of foods they should eat as a nutritionist, because you find that many complications come at old age, but along the way, as people are developing and growing up, people don't really look into the issue of nutrition as a major need. So for us, it is a chance to reach out and help them know that when this happens, you can do this, and why it is important to have a healthy plate even at that time of old age.
Tuko na mawele, si ndio? Simshasikia mawele? Jae. Ile kinga ambayo iko ndani yake.
Ukimwekea kijiti au kijiko atajiuma sana.
Kitambo wamekuwa wakitumia kijiko ya kwamba mtu akianza kushikwa na hiyo kifafa.
We've been teaching basically on first aids. We've been teaching about burns, stroke, heat stroke, fainting and choking, because we find that all these are commonly found in homes. So it's good for us maybe to relay the information to them so that when they go home they can know what to do. Maybe next time they can avoid coming here because they could have prevented that at home.
Mlango umeingia ndani, mlango umeona ya kwamba kuna hizi shida zote zenye nimesema.
When mental health is not attended to, there is something we call, you start worrying, then worry leads to stress, then stress leads to chronic stress that would lead to depression. And when you're depressed, many things happen. Then there are so many things. You find that someone is sick, they keep on complaining of headaches, stomachaches, and all those things. But when a test is done, nothing comes out. So that one we usually attribute it to being a mental health issue because of worrying, and which leads to stress.
I'm coordinating the clinical work together with the pharmacy. It's a great experience for me to work with this community in trying to promote healthcare, preventive medicine, and with the hope of even going further to build facilities within the community.
Our plan has always been to change the mindset of the people, because we realize that because they lack the knowledge, they end up with complications that they would have otherwise have prevented.
It is very important that we now begin to refocus people's attention towards issues like nutrition and stable mental health, which in fact have a very direct bearing on most of the things that make people end up at the hospital, and usually at a very advanced stage.
So the follow-up is lacking, and that's why we are trusting God that the clinic will pick up soon, so that we can have our own clinic to refer the patients that we want to follow up on.
We will try to think about more innovative ways also that we can use to reduce the cost of medicine, and more importantly, encourage all the other players to focus a lot more on prevention rather than treatment.
The future of Passionate Hearts is in recruiting more members and getting especially the young guys involved, being willing to volunteer and carry on the spirit of the foundation.
I wish and I hope in working with Mazira Foundation in future we'll have not just a free consultation but a section of surgery. Yeah, of course, I'll be here for sure next year.
I wish it was even done more frequently so that we just don't focus on one time thing per year.
I feel like I could do it daily, on daily basis, because I feel like I'm helping some people in the society.
It has been a learning experience. It's been very good. It gave me a feel of what I'm in for next year when I actually start treating patients.
It keeps you grounded. It keeps you knowing what the society actually needs. It helps you to even plan in terms of your future in medicine. It helps you know exactly what you need to do in terms of helping the society. Yeah, I think I would really like to be part of the team for longer. Yes.
When you come to other cultures, they always open your heart. They help you to see a new light. And that's what my experience in Kenya has been. It's birth. New ideas, new hopes, a whole new family. I have a whole new family here.
Kwa sababu watu wengine wao wagonjwa na hawana pesa ya kwenda hospitali. Hata pesa tu ya kununua Panadol kila huwa ni vigumu. Sasa mimi naona inasaidia.
Nimefurahi. Tena nimeona nyinyi mlikuja kutukutembelea. Tumeshukuru Mungu.
Tena mzidi kuturumia kila mwaka. Na mbarikiwe tena.
Na hii matibabu nimeifurahia. Muwe mkiendelea hivyo mtusaidie. Ni hayo tu. Mbarikiwe.